Hello, my name is Katie Bauer. I own Nourished Health. I'm really excited that you're here at the website, www.nourishedhealth.com. I'm excited because I think a lot of people need to work on their digestion. Uh, Digestive problems result in a lot of health conditions and problems, and a lot of us don't realize how important it is to take care of our digestion, and also a lot of us don't realize that we have digestive issues. So let me tell you, constipation, diarrhea, stomach cramps, acid reflux, gassiness, none of that's normal. And if you're experiencing those, something's wrong. And I think a lot of us realize, yeah, if I have irritable bowel syndrome or Crohn's disease or irritable bowel disease, that is a digestive issue. But there's also a lot of health conditions that happen that are not automatically things that we link to having digestive disorders when they are. That's how it was for me. I, as a baby, was colicky. I developed rashes to anything synthetic that was put on my body. I had to have my tonsils taken out because I developed colds constantly and was just an unhappy child. And I went from that to teenage years when I had horrendous acne, like monumental, horrendously embarrassing acne. And unfortunately, it persisted into adulthood, which I guess is considered adult acne, though I never had the delay between teenage acne and adult acne. It just continued on. And I also had horrendous PMS. In my teenage years, my cramping was so bad that sometimes the pain would make me pass out. I would get nauseous and throw up, and I didn't realize what it was caused by. And then through my whole life, I also had horrendous nightmares. I would actually wake up in the middle of the night and hallucinate. And I had problems sleeping, I had problems falling asleep, and I never knew what it was caused by. I went to doctors, dermatologists, and nobody could help me. Nobody could help my skin, nobody could help my sleeping, nobody could help my digestion. And because they weren't common digestive conditions, nobody thought it was my digestion. So I really went on a long voyage of researching health conditions and training myself. I went through a clinical herbalism school. I farmed for a while. I went through a natural culinary program. I got my master's degree. I went through a clinical nutrition program also. And from all of this, I was able to start taking away layer after layer of my problems. And there were many. I had to deal with parasites, candida, leaky gut syndrome, and through leaky gut syndrome, I had developed food sensitivities to gluten, dairy, and corn. And really, by working with my digestion to strengthen it, as well as removing these problematic foods and dealing with the candida and dealing with the parasites, I was able to restore my gut function and I was able to restore my health. And now, I have clear skin, I sleep wonderfully, I wake up feeling energized, I feel vital and excited and energized, and I want that for other people too. So that's why I do this. I really want people to be able to renew themselves and restore their vitality and strengthen their health. And digestion is one way that that can happen. It doesn't happen for everybody. The health condition you are facing may not be affected by it, but I've seen people lose weight. For me, I dealt with a lot of my thyroid and adrenal problems, neuromuscular problems, so it's worth a shot. What I would like you to do, if you're interested in checking it out, is sign up for a complimentary strategy session with me. You can sign up on this website, and you'll see with the complimentary strategy session that we'll go through and I'll have you do a metabolic assessment. We'll really map out what your body's trying to tell you. We are not diagnosing, but I'm helping you figure out what are the signs and symptoms your body is manifesting it, and what could those signs and symptoms be a result of. So we'll look at those, figure out what you should start with first, because it's hard to know if you're dealing with adrenal issues, thyroid issues, blood sugar issues, digestive issues. It's hard to know where do you start, and it's hard to know what came first and what's upstream and what working on, what things you choose to work on will be the most effective. So in the strategy session, which is complimentary, we'll really figure out what you should tackle first. And then you can choose to work with me, or if it's not my area of specialty, I could point you to somebody else that would be better suited for your needs. A lot of people walk away from the complimentary session knowing exactly what they need to do and not having to work with anybody. So that's possible too. So definitely sign up, and if you have any questions, please feel free to contact me. You can if you see the form at the bottom of the website, you can ask your questions or make comments there, and I'll do my best to answer your questions or find the answers for you. So I look forward to communicating with you and getting to know you, and I look forward to the strength of our digestion together. Thanks.